Welcome to Talking Tech Journeys, hosted by me, Ben Whiteley of BPM Tech. We're delighted to bring you season 1 of Talking Tech Journeys. The aim is clear, to bring you some of the most engaging and respected figures within tech and transformation, providing a snapshot of their journeys to share knowledge, ideas and insights on all things tech and transformation. Sit back, relax and enjoy the journey. Hi, welcome to Talking Tech Journey Season 1. I'm Ben Whiteley, delighted to be joined by Dr Sandeep Konduru, Consultant Orthopaedic Spine Surgeon, Digital Healthtech Entrepreneur and Founder of Remcare. Remcare are a patient-friendly app that allows clinicians to collect data from patients remotely and use the information to prioritise patients according to risk status. Hi Sandeep, how are you?
I'm really good, Ben. Thank you so much. How are you doing today?
Good. Yeah, looking forward to this. And yeah, I think just before we delve and take you back through your journey, 12 months ago today, are you just able to enlighten our listeners as to where you were and what you were doing?
Brilliant. Yeah, I mean, that seems like a completely different world. I had just got down a mountain in the Himalayas. We started a trek. We were attempting to scale Mount Mera, which is 6,500 meters. And yeah, we just sort of finished that trek, and then we were on the way down back to Kathmandu in a helicopter back from wherever we thought we couldn't get enough transport back to Kathmandu. So yeah, it was an amazing experience.
Just going to say, how was it for you?
Well, we've done this. Is not the first time we've been up in the Himalayas. Usually, May is a good time to go because it's starting to warm up. The weather is quiet, and that's where, as you know, a lot of Himalayan, Mount Everest treks happen in May. But
Yeah.
actually, last year, for the first time in 20 years, the weather was atrocious. On day 2 of our trek, so starting from Kathmandu, which is about 1,500, 2,000 meters. The very first day, if you want to go to Mount Mera, you have to cross quite a high pass, Zatrala Pass, which is about 4,600 meters, which is sort of close to the height of Mont Blanc.
Wow.
And it was it was a severe snowstorm. So we were sort of, visibility was 1 meter. And we could have easily got lost, but somehow we crossed the pass, and it was a very, very arduous, difficult thing. I mean, we went after a week or so. We went up to the high camp in Mount, Mera, and unfortunately, the last a couple of 100 meters or so. The weather was getting really bad, and by that time I had a bad chest infection developing, so we all decided to turn back, so we couldn't really reach the summit. But it was the journey. The journey was incredible. So there you go. It seems like a different world.
Yeah. Probably lots of synergies though in terms of growing a business and like say trying to scale a mountain. So good.
Yeah, I think yes, I think we will probably touch on this later on. Yeah, there's a lot of synergies in terms of perseverance and just sticking to it, and doing one step at a time, really.
Well, that's it. Probably a lot of time and effort getting to sort of the base camp before you even scale that mountain, and no doubt, like you say, setting that core foundation for whether it be your training, climb the mountain, or scaling a business. So yeah, well, brilliant. Thanks for your time. And I know you've got a sort of an interest in AI, digital health technology, and transformation of clinical pathways. So without further ado, let's sort of take you back then, Sandeep. So how, why, and when did you sort of first become interested in health and technology?
Technology was something that I've always been interested in. So, without showing my age, we've seen, I've seen in my lifetime a lot of transition from, internet being, becoming more popular to, everyone starting using computers and all that sort of thing. So I was always fascinated by technology. And the longer I worked in the healthcare sector as a frontline clinician, increasingly, I mean, initially you don't know any better. You think this is the way things are, but the longer you work, you gradually, there wasn't one eureka moment, but you begin to realize that, look, things aren't going as well as they should. There could be better ways of doing things. And especially when you sort of see that in other sectors, in other healthcare industries, there's so much advances in technology, and then you begin to realize that healthcare is really way behind in adopting innovative technology. In fact, I think I won't be wrong when you say, and a lot of people will agree with me, that when the NHS started 75 years ago, how clinical pathways were on then hasn't really fundamentally changed to how it is happening now. Yes, we are getting a lot of technology, but the core fundamentals of how we run clinical pathways hasn't changed. So, just before the pandemic, I thought, look, technology can help here. There's so much we can do to improve delivery of healthcare, and that's how it all began.
Yeah, which we'll come on to, obviously, the tech startup. So just in terms of taking that step back, and lots of things to sort of discuss. In terms of you sort of the first role and within the NHS, I mean, sort of how did that come about? Were you always going to be a sort of surgeon? Was that always the dream for yourself?
Yeah, I mean, surgeon was very clearly, in fact, I wanted to be an orthopedic surgeon right from my school days. I don't know what it was. I think I was always interested in biology, in sort of physics, that's kind of thing. And I had some good teachers. Very early on, I wanted to be an army doctor. That's what I wanted to do.
Okay.
So it's something about wearing a uniform as well, I suppose.
Yeah.
That never happened. I never went into the army, but I always wanted to become a doctor. So, and in my medical training, in my medical college, I had an orthopedic surgeon, a professor who really influenced me fundamentally, and orthopedics. I mean, I'm a very hands-on person, so orthopedics was a very hands-on activity. And that just seemed not a natural fit. And at some point, I wanted to do spinal surgery, so I just sort of gravitated towards that.
Yeah. So, I mean, can you sort of set the scene in terms of you've been 25 years in the NHS, give or take? I mean, how has sort of science, technology, engineering, how has that sort of evolved over time?
I mean, I remember back. I mean, even this is not until this is really until recently, but it was all the more prominent when I started my training as a junior doctor in the NHS. It was all paper based. There was not many digital systems out there. Yes, there were some digital systems, but the predominant sort of frontline clinician workforce depended on paper based notes, hard copies of x-rays, scans, and all that sort of thing. And in fact, there's one thing I distinctly remember. One of my earlier jobs, I was in Scotland in Inverness, and my boss at that time said, look, we're going to do a peripheral clinic. As a clinician, you work in a main hospital. Sometimes you do remote clinics, which is often just down the road in another hospital or another clinic. But then we're talking about Inverness, Scotland, and they said, okay, just we're going to do a remote clinic, just jump in my car, let's go off. And by the way, don't forget to pack your bags. And said, why do I need to pack my bags? So, and then I realized that this remote clinic was actually remote. It was 200 miles north of Inverness.
Right. Wow.
And along with the stuff we needed to take, we actually carried a whole bag of paper-based notes for the patients we're going to see. So which seems completely crazy now, but until very recently, we were still, having paper-based notes and that sort of thing.
Yeah.
So there was really not much technology that, that sort of that we used at that stage.
So pulling from you've asked years of experience within the NHS, and you sort of mentioned this briefly from the outset. I mean, what would you say are sort of the biggest barriers and challenges to the NHS engaging sort of digital change, transformation, and innovation?
Well, look, I mean, innovation and transformation is absolutely needed in the NHS. NHS is a large organization. It's a clinical healthcare organization which is naturally averse to change. The risk appetite is very low. There's a lot of risk aversion as a result. And people are often, in any industry, change is always seen as difficult. There is fear of change, and all of that apply. healthcare industry is very unique in that the majority of the resource is health workers,
Yes,
people.
yeah, true. Yeah.
And any change would involve changing people's behavior. And it's technology only forms a small part. And this is how in my business, with our adoption strategies, technology is only a small part. And it's the people, managing the people, the change behavior, transformation, the upskilling that is needed is crucial. So the biggest barrier is, in fact, that whole workforce management itself. But the workforce itself is an asset as well, if you know what I mean. There's two sides of the same coin. So if you get this right, if you have that sort of engagement from the staff, that what was a barrier suddenly becomes actually a facilitator. I don't know if that makes sense or if it's too vague.
No, I mean, like I said, that there's lots of moving parts, and often hear that it's sort of very siloed and not the most agile and very risk averse. So, you know, quite a difficult sort of scene to ship to turn and ultimately see to navigate.
Yeah, exactly. And especially in the NHS where there are multiple stakeholders involved. You got the patients, you got the clinicians, you got the administrators, you got the system leaders, senior executives, and also the NHS policymakers. There's so many driving forces here. So a transformation has to be aligned to all these stakeholders. So there is a lot of, as you rightly said, there's a lot of moving parts. And unfortunately, it's a slow moving beast. And it's like channeling, all these stakeholders to a common direction. It is challenging, to say the least.
Yeah, often with probably conflicting sort of priorities and timeframes and things like that.
Well, I mean, obviously, different stakeholders have different viewpoints, and this is exactly what I mean is, having those value propositions for each of them, because, your clinic, look, ultimately, it's a no-brainer. The priority should be patients. That is the whole point the NHS exists. But of course, within this whole thing, NHS almost tries to run as a business, so people have different sort of priorities and immediate sort of firefighting that needs to be done. So it's like trying to match people's sort of immediate priorities and give them a value proposition. And it's a slightly different value proposition for every different stakeholder.
Yeah, sure. So, I mean, obviously, like say, 25 years in the NHS. So in terms of, turning your, the focus and lens to your sort of digital health tech entrepreneur sort of background, I mean, what advice would you sort of give doctors or, clinicians interested in a career in sort of digital health?
If we're talking about doctors, I mean, this is my own personal opinion, and this I think has been shaped by my own sort of journey. I've never started my medical career thinking what I'm going to do now. It's sort of happened. What my primary focus was being a good doctor, in my case, a good surgeon, getting all the skill across and embedding myself into the clinical practice and being a good surgeon, delivering the care I need to give to my patients and continuously improving as a surgeon.
Yeah.
This, I think, has to be the fundamental primary goal for any doctor, I think, in my opinion. Now, unless you do this, unless you live and breathe delivering healthcare, doing good for patients, you don't know what the problems are, what the obstacles are in our primary goal, which is improving patients' lives and curing disease. So unless you really live and breathe this stuff, I think, you really don't understand exactly what the problems that are facing are, and also more importantly, what the solutions that will actually fit, because you could come up with, a brilliant solution outside the NHS with no experience in the NHS. And then often what happens is these solutions then look for where can they fit into the industry. So that is the wrong way going about it. So, and this is why I'm a firm believer in frontline clinical innovation. It's us who are the coalface, who know what the problems are, who know what the solutions should be that actually work. And then, unfortunately, there are still very few clinicians who go out there and actually create solutions for the problems they're facing.
Yeah.
So I think my advice is, look, you need to be a good doctor first. You need to really understand the stuff, and then you need to be, not afraid to challenge. And doctors are, like any healthcare workers, are a breed which are, very set in just delivering healthcare, and probably I would also hazard the statement to say that, look, there's not much interaction with the outside world. What's happening? How many doctors know what's happening in the car manufacturing industry? What is happening in the AI industry? Because there's so many things that you can pull in from all these sectors, and it is transformational if you can look at different ideas that cross pollination is really needed. So I think you need to be open to other ideas, but you need to be not fearful, afraid of challenging the status quo, and actually taking that step forward to say, yes, I need to do something about it, and come out of your comfort zone.
Yeah. So, I mean, taking you to 2021, you set up sort of Remcare. So, I mean, at what point did you sort of realise that you could help the NHS and other clinicians sort of, with technology and innovation? I know you said there wasn't sort of a eureka moment, but what was the sort of key driver behind you, setting up Remcare?
Well, I mean, look, it was becoming very prominent. I mean, NHS have always, these long waiting lists in the NHS is nothing new.
No.
It's coming to the fore with the pandemic, but even before the pandemic, we had long waiting lists. And NHS is not unusual. A lot of healthcare systems in the world which have big waiting lists. So this is not a problem unique to the NHS. It's a global problem.
Yeah, sure.
And so increasingly, I think, me and a few of my fellow clinicians, we've noticed that the way we manage clinical pathways is not very efficient. And what I mean by that is the whole point of collecting information from patients is a very manual process. It involves clinicians getting patients into a physical space in the hospital to do a clinic, or to pick up a phone or a video consultation, increasingly post-pandemic, to call patients and then get all this information. That takes a lot of clinical time. And often this information is not always used to customize the care for the individual patient, and also customize the resource allocation within hospitals. And if you look at any car manufacturer or any other industry, they know exactly what the inputs are, and they have exactly the amount of resource for the right kind of inputs that are coming in. So it's a lean methodology they follow. That is absent, in what we do. So I thought, with digital technology, collecting information from patients remotely and using algorithms to stratify them to see which patient goes through which pathway would be the right thing to do. And at that point, we didn't come across any other solutions which were doing it the way we wanted it. And this was the start of Remcare. And then I initially, like I said, even at that point, I never thought I'd set up a business from this. But then I thought, the obvious thing is to go to my IT department in the hospital, say, can you guys build this? And, they said, oh, not in a million years. We just don't have the bandwidth for this. And to be fair, they don't, because they're just so busy. They're understaffed. They're so busy with the immediate priorities. So, and I thought, and then at this point you could say, oh, it can't be done. But I thought, oh, no, we need to still do something about it. And I thought, why don't I do it myself? And this is where I got a small tech team together and worked with the hospital research and development department. And we made all the sort of intellectual property agreements and all of that. And then we set up and built a prototype and an MVP, a minimal viable product, and then basically tested it within our own hospital. And initially, you have this sort of imposter syndrome, saying that, oh, what do I know about tech as a doctor? Surely someone must have done something like this, and maybe no one else thinks this is a good idea. but then once I started talking to people about this, showing the MVP. And it was just a no-brainer for my fellow clinicians, saying, look, this is exactly what we want. Why hasn't anyone done this so far? Kind of thing. And that's when it went on. And that sort of became a business. We got some people around it. And then we didn't have any marketing or a business development strategy, but even just through our own clinical champions, through word of mouth, it spread, and we are still getting a lot of traction from this, just over a period of 2 years, really, since we released the MVP.
Good. So, I mean, how was this sort of transition working full time, in the NHS to ultimately becoming a tech startup CEO, founder?
I mean, the
How did
biggest
you
thing
find
was, the biggest thing was it was completely out of my comfort zone.
it?
And this goes back to your question, what's your advice for, other people who want to embark on this journey? You have to be
Mm,
prepared to come out of your comfort zone,
mm,
because as doctors, we are not trained in terms of
mm,
commercialization, in terms of tech, building a business, all this sort of
yeah.
thing. So there was a lot of upskilling, learning that needed to be done. It was like going back to school again. Um, but the most important thing is, and you'll hear a lot of entrepreneurs saying this, it's a lonely journey. It is a very
Mm,
lonely journey. You don't know who to talk to. And at least at
mhm,
that point, I didn't know many people who had a sort of similar interest to me or
mm.
was on a similar journey. But now I know there are hundreds of people like this.
Yeah.
But at that point, I didn't. And it's trying to go out there, trying to see various people, see who can help. And
Mm,
luckily for me, I got into an incubator program
yeah.
conducted by the East Midlands. At that time, it was called the Academic Health Science Networks, but now they're
Mm,
called the Health Innovation Networks. And they were doing a competitive program where they would, select 4 or 5 companies every year to sort of help with all that upskilling that was needed. And we
yeah.
were lucky to get onto that program, and that really helped.
Mm,
And also there was a Warwick Deep Tech Incubator program
mm.
done by Doric, which was non-health related, but still
Okay.
was
Right.
really
Yeah.
helpful to get the sort of the general business kind of things, the tech kind of thing. And a big shout out to Joanne Bates, who runs that program as well. So these were really helpful in that upskilling. And then, yes, I got onto a few other sort of incubator programs,
Yeah.
and I think, we can talk about that later on as well. So yeah,
Yeah.
so it was a lonely journey to start off with, but now increasingly I'm getting a lot of help, and I know a lot of
Mm,
contacts, networks, and it's
yeah.
much easier now.
Yeah, well, I know you touched on the NIA as well. So, I mean, I know you sort of just briefly mentioned it. Coming from a clinical background like yourself, some of the challenges in terms of running a business. So, how have you sort of how have you benefited from the incubator sort of accelerator programs? How has it sort of helped you as an entrepreneur?
Yeah, I mean, so more recently, I was on the Clinical Entrepreneur Program,
Mm,
which is specifically for clinical entrepreneurs from the
hmm
NHS and increasingly outside the NHS now. And then currently, I'm a National Innovation Accelerator Fellow, which is a fellowship program
hmm
that's shared by Professor Stephen Purvis, Medical Director of NHS England. So these are really useful, and I'd strongly encourage anyone who's going on this journey to get into one of these programs,
mm,
because they do essentially 2 things. One is the core knowledge that you need to gain in commercialization in terms of
mm,
value propositions, health economic and health, real world evaluation. So these are some core knowledge base
mm.
that you need to have to run a business in the health sector, anywhere in the world.
Yeah.
But that's one aspect to it. But the more important aspect to it really is that networking, the peer,
Mm,
that
yeah. Yeah.
conversations in the corridor with a coffee
Mm,
to another person who's on a similar journey as you, and all the successes they've had, and more importantly the mistakes they've done, and
mm,
you learn from other people's mistakes.
sure.
So it's these conversations, these networkings have been incredibly helpful. So for example,
Mm,
some of those conversations helped us get into a couple of new hospitals,
right. Yeah.
and some really good partnerships to
Mm,
fill in the gaps in our product, and go to market with a whole, more wholesome sort of
yeah.
synergistic sort of
Yeah.
solution. So these are incredibly useful.
Yeah, and you touched on sort of MVP in terms of Remcare, and obviously off air we were speaking a little bit earlier in terms of AI and sort of automation, augmentation. I mean, what does the future hold in terms of the product service offering in terms of whether it be AI, VR, AR sort of platform? How are you sort of looking at incorporating it and embracing the such technology?
I think Remkit is a perfect example to answer this question. So essentially what we have, and this goes back to what I was saying earlier, is fundamentally the way we manage clinical pathways hasn't changed for years and years, for decades. But increasingly, what's going to happen is some of that information gathering from patients and the decision making which clinicians have been doing all these years since medicine started in this planet is going to fundamentally change. So there is going to be automation in the way we get information from patients. There's going to be automation of that clinical decision making process to some extent, and of course clinical safety, unlike in other industries where technology is being used.
Sure.
The unique thing about healthcare industry is this whole clinical safety element to it. So this is why the entry into healthcare industries is such a big barrier. And that as long as we get that clinical safety aspects right in that automating that some parts of the clinical decision making, that is fundamental. But that is definitely how the future is going to go. So in terms of, as a clinician, I can see that direction very clearly. So it's almost like, it's difficult for patients to get immediate access to clinicians, GPs, hospital doctors. So AI is going to come in there as a first step there to give some advice and guidance to patients, but also on the other hand, to help reduce the burden for clinicians by automating some clinical decision making, risk stratifying patients, which is what Remcare does, so that clinicians can work now at the top of their bandwidth, reducing the amount of manual, unnecessary tasks that they're doing, and delegating it to sort of, nurses perhaps, and that sort of thing. So what Remcare does this risk stratification to see who's suitable for seeing a consultant, who's suitable for self-management, and which patient is suitable for a nurse appointment. So that is there. And of course, there's a whole sort of other things in terms of automation of administrative tasks. All the note taking, all the manual tasks, robotic process automations, all of that, there's definitely going to come in place, which again will reduce the amount of clinician, time administrators and clinicians spend on administrative tasks. AI, certainly as a surgeon, I can see there's a big role for augmented reality in terms of how we do operations. There's a whole host of process mapping that we can improve better, not just in theater, but the whole operations of the hospital. So there's a huge, I mean, we're going to fundamentally see a big transformation within the next 5 to 10 years.
Yeah, no, absolutely. And there's been a lot of time, money, and investment, a lot of risk and potential reward. So it's just, like you say, just balancing that really, isn't it? So I know you sort of touched on partnerships and collaborations. I mean, are you able to just sort of elaborate a bit more in terms of some of the results and outcomes you've achieved in terms of implementing Remcare as a service and a platform?
Well, the best way to illustrate this is to just tell you a little, real case study. So this is a real story. So obviously I've changed the name. So there's a lady called Beata. She's just been put on, a waiting list for a hip replacement. And she now has a 52-week wait before she can get her operation. So unfortunately, Beata has a lot of medical problems. She has diabetes. She's had a stroke previously. And while she's waiting, her hip pain is getting better. Her condition is deteriorating. She's had multiple visits to A&E because she's struggling. And all this while, her diabetes is getting worse. And then finally, when she gets to her date for an operation, 10 days before surgery, every hospital has this pre-anesthetic assessment clinic, which is where patients are checked to see whether they're fit for an operation. And Beata comes to this pre-assessment clinic 10 days before her scheduled date for surgery. And at this point, the nurse notices that her diabetes is way out of control. And it's too short notice now to control her diabetes. And she gets cancelled off the waiting list. So this is after a 40+ week wait. And just imagine how frustrated Beata is now. And also, if you look at the hospital, now the theater slot that has been scheduled for her is now left unfilled because the hospital doesn't know which patient to pull in at short notice. So the surgeon and the whole theater team are just sitting there doing nothing, which is a criminal offense when you have 8 million people waiting on the NHS.
Sure,
So
yeah.
this is a typical pathway. And now in the same hospital, Remcare has now been used. And what happens is, as soon as the patient, be it is put on the waiting list or another person like her is put on the waiting list, all that information is pulled into Remcare. We contact the patient through a message. Beata fills in a questionnaire in Polish in terms of all her health status details, and that immediately identifies all the at-risk issues. So the pre-assessment team, rather than doing this assessment 10 days before the operation, they're doing it 52 weeks ahead of the operation. So her condition is pre-optimized, and also every 3 months, Remcare would go and contact the patient to see whether her hip pain is getting worse or her diabetes is getting worse, and all that will be highlighted to the surgeon so that they can prioritize this lady compared to others, because waiting lists are managed in a chronological order currently. That's not a good way of managing it. So it has to be managed on clinical priority. So that's what Remcare enables. So what Remcare enables is better prioritization of patients who are on the waiting list, earlier optimization of patients who need that, improvement in their health status, prepare them better for surgery, so that the whole process is much more streamlined. And our real world evidence has shown that the theater utilization has gone up by 7%.
Brilliant.
So that's a huge improvement. And in terms of the pre-assessment clinic nurses, whereas their productivity has gone up by up to 30% with no increase in staffing levels. So a huge increase in productivity, which was a bottleneck to the service. So it has been fundamentally transformational to the hospitals that have used Remcare. And of course, Remcare can be customized to any surgical specialty and medical specialty. For example, the chronic pain service use it. The endoscopy pathways use Remcare. Again, a significant benefit in the endoscopy pathways as well, which are the 2-week wait cancer pathways. So yeah, I mean, it's been transformational.
Plus, ultimately improving patient care that's delivered.
The value proposition is strong. The patients are getting customized care according to their needs and demands. For the hospital, the productivity is increased with no increase in costs. And for the clinicians, it's reduced their burden by automating some aspects of their workflow.
Yeah, no, brilliant. Well, I can certainly see the benefits. I mean, just sort of wary of time and just sort of briefly, I mean, you've touched on obviously your frontline clinical background and experience, and the complexities of sort of healthcare systems. As somebody that's obviously launched a solution, Remcare, for a sort of real world problem, what advice would you sort of give digital health tech entrepreneurs who, I know you said, it's sometimes about the solution, pushing the solution and not the problem. You mentioned resilience, perseverance. Is there any sort of key takeaways that you would sort of, like to just mention and discuss?
Ben, you're saying time is constrained and you're asking me a question which is going to fill the whole day.
Yeah.
But listen, very quickly, the product market fit is very, very crucial. So you have to really understand what the pain points are, what the anticipated gains are, what the people are looking for in the healthcare for frontline clinicians, because ultimately it's the frontline clinicians who use sort of clinical solutions, digital clinical solutions like this. You really need to understand their pain points. And it's not only that, then you need to have a co-design. So that would involve clinicians, administrators coming in at a very early stage during the design of the solution. So it's a co-production. So they have to be incorporated into it so that you're not wasting time by building something which the clinicians take a look at this and saying that this is not going to work. So it's not doing anyone any favors. So, but also more importantly, engaging clinicians very early on would get their sort of they would take ownership of the solution, and that whole change management transformation becomes so much easier. They become clinical champions. So that's one aspect to it. The second aspect to it is, if you're embarking on this journey, it is a hard journey, especially as a clinician. You need to work very, very hard. Resilience and perseverance are the key. I mean, we started this talk talking about a mountain, climbing a mountain.
Yeah, sure.
And I'd like to go back there. So when we were up on this mountain, on the Satrola Pass, in this blowing windstorm, and we've been sleeping on a tent at minus 40 degrees, every sinew in your body is telling you, why the hell are you doing this? Just turn back, quit, go away. And that's exactly how you will feel at some points, but you need to stick in there. And just like in the mountain, however big the mountain is, it is one step at a time, one breath at a time. And so you just need to stick in there. You're going to be ups and downs, but perseverance is the key.
I suppose, you can't see the summit from the base camp, can you? And often getting to base camp is no easy feat.
Yeah, but every single success has to be enjoyed as well. Yes, and that will keep and of course talk to people. There's so many people you can talk to, and it's just that networking and peer sort of support is crucial.
Yeah. I suppose once you reach your summit, then the hard work continues, because you've got to navigate your way down, and the journey continues, doesn't it?
Well, unlike climbing a mountain, there is no summit in this journey. It is just the next thing and the next thing and the next thing. So look, ultimately for that, you have to be very, very passionate. You really need to love what you're doing. So if you have the passion, you will get that perseverance, that resilience to stick the course.
Yeah. Great. Well, look, Sandeep, many thanks for your time, and great talking today. Lots of amazing sort of insight, and best of luck with the NIA program, and all the best with Remcare.
Lovely speaking to you, Ben, and thank you so much.
Yeah, brilliant. Thank you. Thanks for listening. We hope you enjoyed Talking Tech Journeys, and we'll catch you next time. Good company and colleagues in a career make the journey more rewarding. If you did enjoy, please take a moment to subscribe, rate, and review us on your favourite podcast platform. It really helps us reach more listeners like you. Don't forget to follow and join the Talking Tech Journeys podcast group on LinkedIn, where you can join in debate and message us directly if you'd like to be considered as a guest, have any questions, comments, or topic suggestions. You can also email ben.whiteley@bpmtech.co.uk. Until next time, enjoy your journey.